Universe is a wonderful and spectacular creation. Scientific findings prove that it was created and designed by God in a perfect way. Life is gifted to mankind for the celebration of Allah's blessings. Now everyone seems to enjoy the bestowed amenity. Life is a story of success and failures, combination of happiness and sorrows. If a man running about life, it appears his advancing involves frequenting pace with development and progress, accessing Moon and Mars, and on the other side, fighting with miseries and diseases. No one ever feels that this energetic wheel of progress can come to a grinding halt where all the smartness and uttering works energy can be cut off. It is Myasthenia Gravis, a disease never heard of, associated with so many griefs which diminishes the joyous beliefs.
Myasthenia gravis is an autoimmune illness, which means an illness which is immunity based. It has a dramatic presentation.
It is the story of a 10-year-old kid, Muhammad Qasim, who is a brilliant student of grade 5 in St. Anthony's School, Lahore. At his playing age, he was attacked by the Myasthenia gravis a couple of months ago. He was diagnosed and treated by Dr. Nasrullah, Head of Neurology Department, Mayo Hospital, Lahore. Under his supervision, he went through the plasmapheresis procedure by Pakistan Myasthenic Welfare Organization before his successful thymus removal operation. After the treatment now, he is able to drink, eat, walk, talk, and even play at computer independently. He has joined back to his friends.
Problem in myasthenia is at the nerve-muscle junction. And I think at this point we need just to consider what the main events are that allow an impulse to be transmitted from the nerve to the muscle.
I'm suffering from Myasthenia gravis. It is a new name for me, but my doctor simply said nothing to worry because it's not a cancer, it's curable, it can be controlled with the medicines. Earlier I do not know anything about the symptoms. But I was having the swallowing problem, I was having the problem with the speech. Earlier I thought that I'm suffering from some kind of weakness. I just asked so many doctors, but they were unable to diagnose the disease.
मैं जब इस मर्ज मुझे लगी, आप यकीन कीजिए कि बिल्कुल अपहज हो गया। आंखियां गिर गई, मैं चबाता था, चबा नहीं सकता था, निगल नहीं सकता था, चल नहीं सकता था, सांस फूलता था, जिस्म के तमाम आसाब जवाब दे गए थे।
When we come to consider treatment, there are really two major approaches to treatment. One treats the symptoms, that's using anticholinesterase medication that has the effect of prolonging the action of released acetylcholine. And the drug most commonly used here is pyridostigmine, sometimes called mestinol. But in severer cases, we have to think of additional treatment. First of all, if a thymoma is present, patients are nearly always going to require a thymectomy because these tumours can invade local structures and need to be removed for that reason. Curiously, removing the thymoma does not in fact help the myasthenia, but it has to be done for good surgical reasons. In the young patients, who are most often female, with thymic hyperplasia, removing the thymus very often results in clinical improvement. Broadly speaking, 25% will experience a remission within 1 to 2 years, 50% will be very usefully improved, but in 25% the effects will be neutral. In patients who have done well following thymectomy, no further action may be needed, but in those who are doing badly, then one has to consider the use of immunosuppressive drugs. The optimal treatment is probably with prednisolone alone or combined with azathioprine, which is a very effective steroid-sparing drug. And it's with combination treatment that we usually manage these patients. However, there are some who are so ill that one can't wait for the rather slow effects of immunosuppression to become active. And in such patients, we have to resort to plasma exchange, in which the circulating antibodies are removed by substituting albumin for the patient's plasma, and that needs to be done, of course, in hospital. Intravenous immunoglobulin is also an alternative treatment to plasma exchange, probably no more effective, but sometimes more convenient to use. All those treatments need to be done in hospital.
Here is another story of a brother and a sister who belong to Peshawar. They have strong family history of Myasthenia Gravis.
हमारा एक बड़ा भाई था और उसे ये बीमारी तकरीबन 15 साल से अपने लपेट में ले लिया था और आखिरकार वो इतना कमज़ोर है कि इस बीमारी की वजह से उन्होंने पेशावर लीडरिंग अस्पताल में जो है दम दे दिया ना, मर गया वो। तो उसके बाद डॉक्टरों ने हमें बताया कि अब के घर वाले जो है सब इस बीमारी के बारे में टेस्ट किया करें कि आप में से किसी को भी बीमारी नहीं होनी चाहिए।
Now they are being properly treated under the supervision of Pakistan Myasthenic Welfare Organization Center in PIMS, and they will soon be back to their young and normal life, inshallah. Pakistan Myasthenia Welfare Organization was founded in 1990.
जो माइस्थेनिया वेलफेयर ऑर्गेनाइजेशन बनाई गई है, मैं इनके जो ऑर्गेनाइजेशन है, मैं इनको दिल की अथाह गहराई से मुबारकबाद पेश करता हूँ। और इतना नोबल काम यहाँ पर कर रहे हैं। पाकिस्तान की नेकनामी एक तरफ और दूसरी तरफ यहाँ पर इस माशरे में दुखी इंसानों को वो इलाज मुहैया करके और खुदा के यहाँ भी मुसर्रफ हैं और दीन और दुनिया दोनों कमा रहे हैं। आपको बहुत बहुत मुबारक हो। मैं समझता हूँ
Its grassroots effort has become an international organization with credible achievement in the field of diagnosis and treatment of Myasthenia Gravis and Guillain-Barré syndrome. PMWO has collaboration for Myasthenia Gravis research with Oxford University, UK, Northwestern University of Chicago,